Good evening, all. We thank you for being here for Serving with a Purpose. We have Dr. Brooke Harmon. We had her yesterday. We get the pleasure of having her again this evening. So let me give you a brief introduction to Dr. Harmon, and then she'll take it away and tell us all we need to know. Dr. Harmon is an associate professor in nutrition and foods at Appalachian State University. She holds a BS in human nutrition, MS in exercise science, PhD in health promotion, education, and behavior. And she completed a postdoctoral fellowship in cancer epidemiology. She is also a registered dietitian and holds a certificate in gerontology. Before earning her doctorate, she served as the director of dietary interventions at the Cancer Prevention and Control Program at the University of South Carolina. Dr. Harmon uses community-based participatory research approaches to partner with faith-based organizations in the development and implementation of health promotion and disease prevention programs. Much of her work includes partnering with the churches to promote health through culinary and physical activity skills training, as well as research on leadership and environmental factors that influence health-related behaviors. Dr. Harmon, we're glad to have you.
Thank you, Stephanie. Thank you for the introduction. I'm excited to be talking to everyone today. So we're going to talk about needs assessments and congregational outreach, and I'll just give you an outline of kind of what topics we'll be going over. So I'm going to give you a little introduction to kind of how I got into this, how I started doing needs assessments with congregations. Then we'll talk a little bit about why we do needs assessments, talk about kind of where it comes from and kind of the world of community needs assessments, and then why congregations. I'll show you some examples from my work, talk about engaging congregations, both how do we start with congregations, and then also how do we recruit people to do needs assessments within congregations, how to use the findings, and then we'll have time for questions at the end. So a little bit about me. Stephanie gave you my educational background, but through my educational background and my work experience, a lot of my training is in community engaged research. So really working with communities to better understand their needs and to understand how we can help find solutions that work for a variety of diverse different congregations and communities. So a lot of this came from the work I was doing in between my master's and PhD with the Cancer Prevention and Control Program at the University of South Carolina. We were focused on health disparities. We worked a lot with congregations to implement programs. And so that was where a lot of it came from, and that kind of informed my dissertation, which again continued this work of better understanding congregation environments related to health, understanding leadership and their kind of perspectives on health within congregations. And then building on that with my postdoc was a lot around how do we assess needs, how do we assess health outcomes in multi-ethnic populations, is what I was doing at the University of Hawaii. And so all of that has kind of led to the work that I do now with congregational needs assessments. The first needs assessment that we'll talk about later in the talk is the Mid-South Congregational Health Survey, which is what I developed in partnership with some community and healthcare partners when I was at the University of Memphis for about 6 years. And then more recently, the past 4 years, I've been at Appalachian State University, which is in Boone, North Carolina, which is kind of in the western corner of North Carolina in the Appalachian Mountains. And we modified the Mid-South Congregational Health Survey for use here, and we call it the High Country Congregational Health Survey. So I'll talk about that modification process and how that looks here in Western North Carolina. So to start, I just wanted to give a little background on congregational needs assessments and community needs assessments, what they are and why we use them. So anytime you're thinking about a community, there's an underlying set of needs that need to be addressed. And oftentimes we have services and programs that meet those, but there may be a gap in services. And so needs assessments help us to systematically evaluate the health status of communities, determine needs that are present, and then identify whether or not our programs and services are meeting those needs. And if they're not, what needs do we then need to be focusing on? So there's lots of reasons why we do community needs assessments. Oftentimes it's because we're starting a new program, and we either want to know kind of how to tailor that program to a community, or we want to know what population we should market to kind of attend the program. Community needs assessments are also mandated by some government organizations. It may be in-house or it may be external. So for example, nonprofit hospital systems have to do regular community needs assessments. Other agencies and organizations also have those types of mandates. Sometimes we are looking to update our data. So maybe we have outdated information about a community, or there's been changes in the community or a segment of the population, and we want to reassess whether or not certain needs are still present, or there new needs. Sometimes the prompt comes from the community themselves. So they maybe have seen some sort of research study or data from a different community. They want to know if they have kind of similar needs, want to work with us, if maybe we've been doing this work in other communities and are reaching out. And then the last one is funding. So anytime we're applying for any sort of grant funding, then we're looking to have data in our application that shows that this funding is going to go towards a particular need that is prevalent in our community. And so to make those applications stronger, it's really important to have data to back up needs and the reason why you need funding for a particular program or strategy in your community. So I teach a community nutrition class, and this set of steps for conducting a needs assessment come from the textbook that we use. And it's not always this kind of, you do this step and then you do this step and then you do this step, but I do like this framework for helping us to kind of think about the overall picture of how you conduct a needs assessment and kind of how you then think about the findings and using those findings. So first step is to kind of set your parameters. So you may have a congregation, you may have several congregations, you may have a congregation in the community they serve, you may be working with older adults in a congregation or older adults across several congregations. So just determining who your population of interest is and kind of those parameters of how you're defining your community. Then you develop your data collection plan, and we'll talk about this as we get further into the presentation, kind of tools to use, thinking about how mode of delivery of the needs assessment, those sorts of things. And then you roll out your data collection. So you get information about individuals who are part of your target population, kind of that larger community context, the community environment and background. And again, I'll give you some examples from my work on kind of questions that you might want to ask as part of a needs assessment process. Then you analyze and interpret the data, and I'll show you some of the ways that we share findings. Most of the data that we're analyzing, it's a lot of frequencies and so counts and percentages, things like that. So it doesn't have to be really high tech, but the big piece, or kind of the step 5 through 7, is really making sure that when you're sharing your findings that you're having the community involved. So you don't want to just share findings with kind of top level leadership. You want to make sure leadership is there, but you also want to make sure members of your community and kind of you're covering the breadth of that community. So kind of all of the different pieces of the community are present, because that's really going to help you set those priorities and choose a plan of action that's going to really work for the congregation, set of congregations, larger community that you're working with. And so all of this has kind of been done in the context of kind of larger communities, but we started doing this work with congregations specifically. And the reason why is when we look at maps of kind of engagement with congregations and engagement with faith-based organizations, we see a high rate of engagement in the South. And so this is a map of Tennessee, and this is congregation density. So this is showing number of congregations in each county. And so the max is over here in Shelby County. There's about 1,500 congregations there. The smallest number of congregations in a county is actually in Pickett County. There's 15 congregations. And then the average for counties in Tennessee is 141. So on average, a county in Tennessee has about 141 congregations. So we know that these are a large part of each of the counties in our communities. In Tennessee, we see the same thing in North Carolina and South Carolina and other parts of the South. And so engaging with congregations really does help us access community members and really work with partners in these communities to really try to understand needs and then address those needs. And so I just wanted to share this website. So this is the Association of Religion Data Archives, so ARDA. And they have this community profile builder that's really helpful and interesting. So you put your zip code in, and then it takes you to a map, and you can kind of hone in on the map of where you want to look at closer, and you can tell it kind of the mile radius to pick on. And then once you click on it and you click profile, it'll bring up a profile. It'll tell you all the congregations that are there. It'll tell you the predominant denominations, and then it'll also give you demographic information. So income, gender, age, how many people are homeowners, all sorts of kind of economic and social data that you may find helpful when you're doing kind of this type of work and trying to find congregations and try to understand, the congregations that are in your community that you may want to do this needs assessment work with. So next, I'm going to share some examples and some pieces of the tools that we used with the Mid-South Congregational Health Survey, and then I'll talk about how we adapted it here in the High Country. So the Mid-South Congregational Health Survey was a community healthcare academic partnership. So we worked with Methodist LeBonner Healthcare in Memphis and their Congregational Health Network. So this is a network of congregations that are connected to the outreach programs at Methodist. And so there's about 300 congregations that the hospital works with on a whole host of kind of health-related outreach. Church Health is another healthcare organization. They're more of a kind of primary care clinic and other kind of healthcare services. They also have a congregational health promoter program, so they also do outreach work with congregations. The National Faith-Based Mobilization Network is actually an effort of Pastor Miner and his wife Lottie in northern Mississippi. And so they had also been doing a lot of congregational outreach. They had partnered with Miss Bettina Campbell, who'd come from Detroit, Michigan, and had been doing kind of community and congregational outreach there. So they had a lot of knowledge about the communities in Memphis and northern Mississippi. And so we partnered with them and our healthcare networks, myself and a colleague at the University of Memphis, and then also one of our colleagues at Johns Hopkins who had been doing this work in Baltimore. So we were kind of the organizations that came together. And then we kind of developed tools, and then we shared those with congregations, and the congregations gave us lots of feedback, lots of changes. And so between kind of these partnerships and then working with the community directly, we developed the tools that I'm going to show you here. And so this work actually started in 2018. And so we started with, kind of the steps of the needs assessment process. We collected information about the individuals who were completing the survey. So demographics, role in the church, length of time attending the church. And then we also wanted to get a sense with some questions over here about why individuals are attending the congregation. We know congregations are fulfilling kind of spiritual health needs, but we also wanted to see if there were other kind of social and health related needs and other types of ministries that individuals were looking for from their congregations. And the congregations in particular were interested in adding these questions. Then we asked questions about the congregation, so denomination, zip code. We were interested in congregations if they had funding, grant funding experience or interest, because we were interested if we found congregations who had similar needs and were interested in going for grant funding, could we partner with them and kind of get them to kind of work together collaboratively, and we could do some workshops and grant writing with them and that sort of thing. So we incorporated that. And then we also wanted to get an idea of the context, the health context within their church. So what sort of things were they already doing? Was their pastor interested in health? Was the pastor kind of talking about health from the pulpit or in other ways? And so we added these questions as well. And then to better understand needs, we used this index of health needs. So individuals who completed the survey could check all of these if they wanted to, or which ones they thought were needs that applied to their congregation. This was where we did a lot of work with the congregations on the language to use and how to get it down to not being like 40 pages of needs. So we looked at national data, we looked at state data, we looked at regional data, and then we also got a lot of input from the community as to what needs to include. So we included mental and physical health, but we also included social determinants of health. So pieces that are part of the environment, social and physical environment that we thought were important and that the community also suggested we needed to kind of look at and could be potential needs in the Mid-South. And then we had individuals who do the survey to select a top need. So before they're telling us all the needs, and now they're saying, okay, this is the need that I think my congregation needs to address with programming. And at the bottom, we also allow them to put information about barriers. So we wanted to get an understanding from congregations of barriers that they may be in place that would keep the congregation from being able to address the need, because we might need to address those barriers first before we could actually address the need. So that was the Mid-South Congregational Health Survey. When I moved to Boone in 2020, I started talking with their basically equivalent of the Congregational Health Network that's called At Faith Health. So it's the same type of program. They work within the healthcare system here, and they do outreach with congregations. I started meeting with them, was telling them what I had been doing with the Mid-South. They knew about the Congregational Health Network already, and so were really interested. And so in the spring of 2021, my community nutrition class actually helped work with At Faith Health leadership. And then they identified 5 congregations that they thought would be early adopters of doing these needs assessments to meet with us. There were probably 2 or 3 members from each congregation who met with us. And basically we were working to adapt the Mid-South Congregational Health Survey for this region. So we did some refining of the demographic questions. We changed a little bit of formatting, but the biggest thing was we changed or we added needs because we were taking this needs assessment from an urban area, primarily African-American congregations, a lot of middle to kind of larger congregation sizes, and we were bringing it to a rural area that was predominantly white and primarily small congregations. So we wanted to make sure that the questions we asked reflected the community where we were kind of implementing the needs assessment. And so this is the top needs section from the High Country Congregational Health Survey. I'm just going to highlight some of the changes and needs that were added and kind of revised. So one of the things the congregation said is that they had a lot of older adults. And so these additions kind of align with that. So they wanted to add caregiving, transition and care setting, affordable medication, programs for seniors. And they also wanted to add this kind of coping with loneliness, isolation, and connectedness as an issue. Some of this was coming from having older adults who were homebound. Some of this was also coming from the fact that we were in the midst of COVID at this time as well, and kind of really understanding this issue of loneliness and isolation. Because this is a rural community, access to waste facilities, waste services was something they wanted to add. And then in keeping with kind of thinking about kind of what is happening in the larger world that might influence needs that are expressed, they also wanted to add this kind of creation care, environmental awareness as well. So, you know, the needs and the kind of formatting and changing of a needs assessment will depend on what your kind of community is like and whether or not a previous needs assessment kind of matches your community. I have a colleague who's in Alaska who's using these same needs assessments, and he's working with Native Alaskan communities, healthcare systems to really think about how they need to adapt their needs assessment for the population there. And they have urban populations and they have very rural populations, and trying to think about what are the needs and what are the kind of format they need to have so that you have it so that it matches kind of the needs of your community generally, but is not too overwhelming in kind of length and breadth. And so let's talk a little bit next about engaging congregations. So we've talked about kind of the why needs assessments. We talked a little bit about the how, and I want to talk a little bit now about kind of how we engage congregations, and then how we talk and kind of recruit congregation members and leaders to take our needs assessment surveys. So the first thing is connecting with leadership. I've been very lucky in my work because I've worked with networks that are already established and have established partnerships with congregations. And so I've been really lucky in that respect. Most of these connections are with pastors or with ministry leaders. And so often, the pastor gives their permission for us to kind of do this work, but often it's not the pastor that's actually doing the data collection or kind of getting individuals in the congregation to do the survey. It's usually another leader within the congregation. So that could be a ministry leader if that's the organization of the church. It could be a nurse or a physician or somebody in healthcare if there aren't kind of a formal ministries, but usually there's some kind of leader who the pastor and that person are who you talk to kind of explain the benefits and kind of understand the process. And so as part of that conversation, you just want to make sure you're clear and transparent about roles. So who's doing what? The way we've divided the task is the congregation person, contact person. They're really the person who recruits individuals in the congregation. They're the one that passes out the surveys or gets the link to the survey to the congregation members. And then my role has been to make sure that we get the data, that I clean it, that I analyze it, and then I get reports back out to the congregations. And you just want to make sure if you're collecting data and you're not within the congregation and you're collecting across congregations and you may be sharing it with higher level organizations or with like networks of congregations, that you just are careful about collecting names and sharing information. So we never collect names on any of our surveys. And we always are careful to not name congregations or not identify individuals when we are sharing our information. So sometimes we have to condense things and we kind of have to redact things so that we just make sure we're not sharing any identifiable information about congregations or individuals without their permission. And then the last part of it too is making sure you're explaining the benefits to the congregation. So once you've got your contacts, everybody knows their roles, everybody knows that we're going to be thoughtful about not sharing information without consent. We also then just want to make sure congregations understand, like, you're going to get a report from this, like it's not just me collecting the data, I'm going to be giving this data back to you. I'm also going to be working with you or kind of having these conversations about what we can do with this data. So, and I'll talk about what some of the programs that come from these needs assessments have looked like. But I think it's always important for congregations to know that this isn't just collecting data to collect data, but the hope is that this is going to really help them to kind of shape programming and efforts to meet the needs of their different groups in their congregation. And so then once you got your connections and your congregation is on board and you kind of figured out who's doing what, then you have to get people in the congregation to do the survey. And so there's a mix of how people do needs assessments. Oftentimes we see needs assessments are just with the leadership, so senior pastor or maybe a few other leaders. We feel pretty passionately about making sure that we have a leader, at least one leader completes the survey, but that also we have members who are completing the survey as well. And part of this is because we've seen over time with our work that leaders and members have similar perceptions on needs, and they may have similar perceptions on barriers, but there's a little bit of a difference there. We do see some differences in kind of the ranking of needs. We may see some different barriers presented by leaders and not by members. We also have found in some of our work that leaders may be more familiar or more aware of resources related to health in the congregation and community than members. So we just want to make sure that we're getting the collective information from the congregation. The number of people depends on the size of the church and kind of some other pieces to it. We have always, because I work with networks who work with congregations, we've tried to keep it a fairly manageable number of surveys. So we try to keep it at about 1% of the congregation, no fewer than 5 surveys, no more than 30, because we know that this is a lot of time and effort to do this work. And this is not the only thing that individuals and networks and organizations and churches are doing. So we don't want to add a burden to them. It also can get burdensome if you're the one doing the data analysis, because you've got to look at all of the responses. And so you don't want to make it a lot of burden there either. But because there's so few people, we just want to make sure that our demographics match the congregation. So we want to be purposeful in who we're recruiting. So, if we have an older female, we want to get an older male. If we have someone who's homebound, or we have people who are regular attenders, we just want to make sure that we're getting kind of a good cross section of our target population. And that's why I think it's really important that the congregation leader and your person who's your connector to the congregation is the one who really approaches members and does the recruitment there, because they know their congregation, they know who would be representative. And so we work with them on that, and then they pass out the surveys. We've given it in paper and online version. So we have Qualtrics here. We've used SurveyMonkey in the past. I know in the last webinar, we talked about Google Forms. All of those could be used. Most of the time, our congregations do want to use the online link, but oftentimes we've had paper used as well. And oftentimes we've had a mix. So we've kind of had a variety. And sometimes the paper is used because the person at the congregation who's helping you with this project, they want to kind of make sure that people understand how to fill it out. So they may bring them together in a group, and everybody does their individual survey after they've been given directions. We were talking about literacy in the last webinar. I haven't had anybody tell me, but they may also be asking for paper surveys because they need to read it to someone. And then there's also been here some conversations about technology. Do people have a computer? Do they have internet access? So we provide both options. If they do paper surveys, we enter them into the online system just so we have it all in one database. But we do offer that flexibility in kind of the mode of the survey. So we've collected our data, and now we have findings. And so I'm going to talk about how we share findings within congregations, and then also how we look at findings across congregations, because you may be working with one congregation, or you may be working with a set of congregations in a zip code or within a denomination. And so we find that both congregations themselves have developed programs, but then also the networks and groupings of congregations have also used the findings to develop programs. So one of the things that I do is, once I get all of the surveys back, I create congregational reports, which are basically a set of slides that give information about who participated. So giving them a snapshot of the demographics of who did the survey, giving them a snapshot of, the resources that people identified for health. And this is important because sometimes members will not note certain resources, and then that is actually a place of education and work that needs to be done to make sure that people know, hey, these are resources that we have available in our community, in our congregation. Then we give them an overall view of needs that were identified, the top needs, and then barriers. And we give this to each congregation, but then we also have been doing periodic updates. And so this is actually an example of a handout that we did about 6 months ago now, here for some clergy, from senior pastors in the congregations here that are part of App Faith Health. And so this one, we were looking at kind of differences in leaders and members. And so you've got kind of the purpose and our methods. We gave them a little bit of information about those resources. We gave them information about demographics of who completed this. And then we looked at this kind of overall needs, overall barriers, and then how this differed between members and leaders. And so these were kind of the types of things. We've done this. We've done just kind of a PowerPoint presentation with clergy leadership in the past. So just every so often we give these kind of snapshots of the whole kind of data set and where we are as a network. And then that has led to a variety of different programs. So congregations have developed programs in-house, and then we've also developed programs based on these kind of overall patterns that we're seeing. So in the High Country and in Memphis, or the Mid-South, we've seen mental health and then loneliness be two of the main issues. And so with loneliness, we've had churches who developed kind of these luncheon programs where they offer lunch and they have games, and it kind of gives some social interaction a couple of times a month. We've had support groups and grief groups that have been developed. One in particular was for individuals who have a partner who has a long-term illness, and there's a lot of care involved, and they're kind of a caregiving group for a specific population. And so different types of programs. We've also, at the network level, the network has developed a program in which clergy who are at the hospital seeing congregation members and stuff can come and get a coffee and have conversation with at Faith Health Network leaders, but other clergy, to also help with clergy isolation, because that's also an issue that we've noted. And then with the Mid-South, we've done a lot of work around mental health first aid and making congregations aware of that as a resource. The Methodist Hospital System has this mindfulness-based stress reduction program that they offer to associates and patients. And so doing a program to make congregations aware of that and what mindfulness is and how it relates to a lot of concepts such as prayer and contemplative practices. And so that they, know that that's a resource and an option for helping with things like anxiety and depression. We've also here are working on bringing in experts on loneliness and who have kind of a faith-based background and are able to talk to congregations about how congregations can really be a support system in helping individuals overcome feelings of isolation and loneliness. So in-house programming by congregations and then also network programming can come out of these needs assessments. And then I'll just talk about some barriers. So if you're real into data collection and real into kind of tracking, sometimes it can be hard to get an understanding of those next steps. So I'm going to show in the next slide, I'll give you my link to my faculty page where I have our needs assessment tool and some other tools that we developed to help with this process. And one of those is a form for churches to use to help them think about that action planning and planning those next steps and then giving us that information so we know what they're doing and can help. And that hasn't really gone according to plan. Most of the time we learn about next steps from congregations, that in-house programming through word of mouth. So, I'll talk to the network leaders. They'll tell me church so-and-so is doing X, Y, and Z. And so that has not gone quite as well with the data collection as we had hoped, but we still know churches are doing things. We just have a different way that we learn about it. The other thing that we haven't been really successful with is follow-up. So we had hoped to align our congregational needs assessments with when the hospital was doing their community needs assessment. So that's like every 3 to 5 years. And COVID happened and changes in kind of hospital dynamics and needs and things that they wanted to address have come up. And so, and then here we've had kind of a slow start, and then we've had churches who are really interested, but they've had other priorities. And so getting them to do the needs assessment initially has been slow. So the follow-up piece has been a little bit harder to kind of time that and figure that out. So these are still areas that, we are trying to figure out, because we think it's really important to do the needs assessment, but then to make sure that we're doing action plans, that we're not just collecting data to collect data, and that we're also not just kind of resting on historical data, but that we're staying up to date on needs so that we can make sure that we're being proactive in our approaches. And so I'll just leave this here with my contact information. So, and I know Stephanie will share this as well, but my phone number, email, and then my faculty page where you can go and find some of the tools, the full tools that I've talked about here, but you can get an actual copy of those. So I'll stop there and just see if there's any questions.